Hey friends, it's LlamaMamaKayla. Thank you for joining me today. Today is day 5 of Feeding Tube Awareness Week. And my day 5 is actually on the next week, but that's life. You know, things happen. I had such a stressful week last week. Just pretty much about 3-4 weeks there was just pretty stressful, and just worrying about all the COVID going on with my parents. My sons had it, and then my parents had it, and I mean, they still do. They're in the hospital. But Saturday, I slept all day long. Like, I just slept. And I needed that, I think. I just was run down and just needed to rest my mind, I think. So anyway, it is what it is. So today is my day 5 for Feeding Tube Awareness Week. And I thank you for tuning in and watching. Today I am answering some questions that some people have asked. And my friend Laurel asked, what does my formula taste like? Well, it smells like vomit, so I'm not going to taste it. It's not meant to be tasted. It's unflavored. It's horrible. And I'm not putting my tongue to it. Because it does smell like vomit. I mean, it really does. So, there we go. We got that out of the way. I'm not tasting it. Okay, and Blue Heart Crochet says, thank you for being so courageous and sharing your story and life with a feeding tube to bring awareness. There's so much we don't realize that goes on into having a feeding tube. Thank you for your comment, Blue Heart Crochet. I appreciate that very much. I don't want to say your name wrong. You comment so sweetly all the time. It starts Joanna, maybe? I hope I'm not saying that wrong. And I hope the H isn't, the J is an H sound. Joanna, I'm sorry. I should have asked somebody to help me before I started saying names. There's so many steps to do in one day, more than once a day. Really appreciate your sharing with us your knowledge and daily struggles. I was not aware how any of this worked. It's always great to know, and it was not graphic at all. Blessed day to you. Thank you so much. I know you comment on all my videos, and I appreciate you so very much. Thank you. Carla says, hey Kayla, I've heard you mention a button type a couple of times. What is that, and how does it work compared to what you have now? Thanks for all the information, and bless you for having these videos for us. Well, thank you for your comment, Carla. Okay, what I have now is considered a peg tube. Like, there's a hole in my stomach, and there's just a tube sticking out of it, straight out, like this, as you saw in my video. Okay, there's a thing called a button. There's a Mickey button and a Brad button. A button is, you have this, you have this hole in your stomach. It's not that big. It's more like that. A button is this little thing that goes into your stomach and has a balloon on one end that you blow up, and the other part is pretty flush with your stomach. There's nothing like poking out. It's just a little thing that opens up, and it looks like a valve on a beach ball, or like blow up Ralph's or something like that. It looks about like that. A little bit more well made, but that's basically what it looks like. So it's flush with your stomach, and you don't have this tube flopping out there, So I really want to get a button. Formista says, thank you for being willing to show us. It really wasn't graphic at all. I'll be honest, I knew that it would be a hole because that's what you told us. But it was hard to wrap my head around the fact that a human body can have a hole, a healed hole. I'm sure it wasn't easy to show everyone as it's personal, but you really did a great service educating this week. I'm sure it's exhausting maintaining and caring for your health and feeding tube every day. I've been continually praying for you and your family. It's such a blessing to visit with you all week. Thank you so much. You don't know that. That's just so sweet. I appreciate that so very much. Lots of people had asked about my feeding tube and wanted to see, but I was kind of hesitant because I don't know. I just didn't want to gross no one out, and so knowing that y'all don't see think that it's so graphic just makes me feel better because at times, especially when it's yucky, at times I just feel I don't know. I'm just it's emotional. I'm sorry. I know y'all understand. Thank you. Hooked on Wishing Crochet said, "Thank you for sharing. It was just graphic enough to show us a clip of your everyday in a respectful way, and that's what I'm enjoying most about this series on feeding tubes. You're educating us in a way that covers the details while still maintaining a level of grace and honesty. I appreciate you. I work in assisted living, and I'm sure one of these days I will come across an individual needing my help. The company I work for has offered medical aspect training. I'm glad I will be able to have a basic overview of emotions that are tied to an individual and not feel so nervous to lend a hand. Thank you for sharing so freely with us. That takes a lot of strength, and I wish you the very best." Thank you so much. But she goes on to say, "Do you ever feel other aspects of eating while your body absorbs the liquid, like watery mouth or wanting to chew?" Yeah, like even whenever I take my formula and I'm full, I still want to eat something. Like, I just want to eat something, okay? You know? My mouth is dry a lot, so I need to drink something for the dryness of my mouth. So I have a lot of dry mouth. She goes on and asks, "Is the temperature of the liquid cold in your stomach? I guess I thought the journey through the stomach brought our food to room temperature." I don't really know about that, but if my formula is really, really cold and I take it, I do kind of get cold, as if you was to eat ice cream, I guess. You might cool off a little bit or kind of feel a chill. I don't know. Yeah, I mean, I still want to eat. I mean, I do eat some things, but yeah, I would like to just, I guess the chewing makes, we're not chewing and eating something kind of makes you feel like you didn't eat. Maybe. Maribel is hooked says, "So hard to believe it's been a year. Thank you for sharing." It has been a year, and it's been a long year. Thank you. I appreciate you always. I appreciate y'all. Thanks. Mary Susan says, "Thanks for sharing, Kayla. Truly informative and educational. Blessings to you and your entire family every single day. Hope your kids and parents are well from COVID. Stay safe." Thank you. My next video coming up right after this will give a whole update about my parents. And so I appreciate y'all very much. Run Shadow Beth says, "Hi Kayla, thank you for sharing this with us. It's very informative, and I was wondering if you could feel the formula as it goes into you, similar to someone's question about do you feel fullness afterwards. As the formula is going in, I don't really feel it like going inside my stomach. Just as if you drink food, you feel it. You might feel it going down a little bit, but you don't really feel it when it gets in your stomach." And then she asked, "Do you feel a fullness afterwards?" I do feel a fullness, like when the formula goes in, and when I get like too much formula or something, it will feel full, and I'll feel like I'm about to throw up. I mean, I get nauseated and feel like it's coming up. If it goes in too fast, it'll start like feeling like it's coming up my esophagus, and I could get sick and throw up. But that's a lot to deal with. I know It's become part of your routine, but my, how time consuming. You must go through tons of supplies. The clamp would be wonderful for you, as far as I can tell, as an observer. Yes. I'm praying for your parents. Thank you for persevering with this information series despite what's on your mind. It's been a lot. It's been a whole week of just a lot of stress, emotional. You are one courageous woman. Take care. I'll stop by tomorrow and catch the finale. Well, I'm afraid it's a few more days, but I hope you do come back and catch this. But thank you for your comment. Joy Lynn says, this was so interesting and informative. I knew nothing about feeding tubes before this. You're an inspiration. Thank you for sharing. Thank you for your words, and thank you for watching. Verna says, thank you for sharing. I'm sure you've probably already your questions now, but do you ever feel hungry? This was informative. Yes, I do feel hungry, even though if I get a feeding, I do a feeding, I do still feel hungry. That, like, the stomach doesn't stay full for, you can go by, baby, it's okay. The stomach doesn't stay full for, like, a long time, and so therefore, I'm hungry again. Okay, Sarah says, thank you for sharing the feeding tube info. I have not dealt with one, but have been close to having one. I spent 6 weeks on IV nutrition in the hospital. I had to do that too. I have dealt with wound vacs, insulin pumps, CGM, I'm not sure what that is, self-catheter. The more we normalize health and body discussions, the more aware, educated, and compassionate we can become. That is so very true, and that's why I do want to bring this feeding tube awareness to people, to know that, it's some people's lives. They don't choose it, trust me. But, and so I'm sorry for the trouble, Sarah, I am sorry for the troubles that you have been through. I'm not sure exactly what your, medical issues are, but any medical issues are, hard to deal with. And I did spend some time in the hospital on the IV nutritions too, TPN, I'm assuming you're talking about TPNs. So I had a catheter right here, and so it fed me the bag of, I'm losing my words, the bag of nutrition. Sue says, thank you for sharing. A friend had one, and she had a large bag that was carried in a backpack while it emptied. This was about 10 years ago. Times change. Thankfully, they're always coming up with new stuff and, better and more convenient for people. So that's awesome. Joy says, I think I've been lucky with my first tube being trouble-free and being able to get a button after a year of the dangler. I do love the button and hope you get one soon. Me too, because I'm sick of this dangler. I mean, sometimes, like, when I'm putting on my shirt or taking off my shirt or just whatever, it catches it and jerks it, and it's just like, and sometimes one of the dogs might jump up on me. One of the larger dogs might jump up on me, and they, hit it and grab at it. I mean, not purposely, but their foot kind of snags it, and yeah, I want a button so bad. I'm so sick of this dangler. How do they expect people to use a tube with no clamp? Exactly. And let me finish reading your comment, and then I'll come back. Not sure why they do them that way. I've heard of people using a chip clip bag and some other type of clip as a temporary clamp. I want to check into that, because it is ridiculous trying to hook up and unhook and stuff like that without a clamp. I mean, I try to, like, bend it to cut it off like you would bend a water hose to cut it off, and the problem is this tube is just so short. The tube I had before was really long. She says, my first dangler tube had a clamp, thank goodness, and my button extensions have clamps. My other tube was very long, and it had a clamp, and it was just very nice and easy to use. This little thing, now the night that my other tube, I accidentally cut it with the scissors. The scissors just happened to be laying there. I was cutting my bandage off, and I was like this, and my husband came in and started talking to me, and I looked up at him as I cut, and my tube was in there, and I was just like, I cut my tube, I cut my tube, I cut my tube, and he's like, okay, well, let's go to the ER, and I was just like, I can't believe I cut my tube, and I was supposed to get in the shower, so I went and got my shower, and then we went to the ER because I had to have a tube. And then, so anyway, this is what happened at the ER. They gave me a shot of morphine. Yeah, they gave me a shot of morphine. And so I'm laying there on the little bed thing, the little cot, whatever you call it, I don't know. I'm laying there on that, and the morphine started kicking in, and I'm feeling, you know, the morphine's kicked in. And this is the thing about it, though. I had not realized I had lost weight, and therefore they didn't weigh me that night. They asked me how much I weighed, and I told them my old weight, and so they gave me the shot of morphine, I guess based on my old weight, and I've actually lost 45 pounds, and so they gave me a large dose of morphine. And so when the doctor's putting that in, and I'm asking all these questions, because he was stitching the bumper to my skin, and it was just like, I'm thinking in my head that's not going to work, because the 4x4 gauze has to go up under there, you know, to get to drainage and stuff. And so I'm just, logically, I know it's not going to work and what's going on. But I don't know what's coming out of my mouth. So I'm trying to say that to him, and he's just like, oh, it'll be fine, blah, blah, blah. And then I'm like trying to tell him why it's not going to be fine. And he's like, he was kind of like, huh? And so then I realized, okay, I've had morphine. I may not be making sense. I better just shut up before I end up in the psych ward or something. So I just quit explaining it to him. But I was also trying to ask him, why didn't it have a clamp? That I had to have a clamp. And he was just like, oh, you'll be fine without a clamp. And I was trying to explain to him why I needed a clamp. And I don't know that, well, I don't even know what I was saying. Because, and I did have the, you know, thought process to think. I just had all that morphine, and I don't even know what I'm saying. So I just shut up. Kayla, this is from Sandy. She says, hi, Kayla. First, I want to say thank you so much for doing this. I know it has to be hard, physically and emotionally both. Yes. I really do appreciate you, sweet lady. Thank you. My question is, do you feel full after getting your formula? Does it feel like you've eaten a meal? And also, well, I can't remember the other question. Sister, I'm right there with you. I can't remember either. So if I remember, I'll come back. Just to let you know, I'm thinking of you and your family. It's been so good that you've been able to do a lot of videos lately. Hugs and love. Thank you, Sandy. Like I said, I do feel full, but yeah, I still want to eat something. I mean, I feel full for just a short while. But, you know, that formula doesn't stay in your stomach. It goes away. And then my stomach feels empty, and I just want to eat something. So, yeah. It's a battle. My stepmom has a feeding tube. They are necessary this is from Vonda. I'm sorry, Vonda. Vonda says, my stepmom was on a feeding tube. They are necessary at times. So grateful for them. I feel for everyone who has to have them, though. Bless you. Well, thank you, Vonda, and I'm sorry that your stepmom has to deal with that also. So I'm sure you're familiar with, you know, the ongoings of it. Cindy says, thanks for the videos, Kayla. Can you eat or drink anything? Do you feel hungry, full? I'm praying for your parents. Take care. Thank you, Cindy. I appreciate those prayers. I can eat, like, I have to eat things that's going to go down. Soup, mashed potatoes, I could eat a baked potato mashed up, oatmeal, grits. With the oatmeal, I do have to drink a lot. I can drink anything that I want to drink. Water, tea. I'm not a Coke person. I don't drink Coke. But, so whatever I could eat that'll go down, like ice cream, applesauce, that'll go down. But, like, a hamburger is not going to go down. Pizza is not going to go down. Chicken is not going to go down because chicken doesn't break up. Like, I need things that, like, break up into tiny pieces and can pass through and go down. So, yeah. So Joyce says, "Hi, Miss Kayla." And I want to say, Miss Joyce, you don't have to say Miss Kayla. Thank you for sharing. You're a strong lady. God bless you and keep you safe and well always, and your family. Have a wonderful weekend. Thank you, Joyce. I appreciate that so much. I appreciate you always commenting, but you really do not have to say Miss Kayla. We're probably the same age. My tube is okay, this is from Kathleen. Kathleen says, "My tube is located very high up also." Well, that's good to know because the pictures I have seen and the YouTube videos I have seen, and also my son's, their tubes were like down by their waist, and mine's just right up under my breast. And I was just so confused. Like the first tube they put in when I came out of surgery, well, probably not when I came out of surgery, the next day or so when I was awake enough to realize, and then I was laying in the bed and I was like feeling down here for it, and I couldn't find it. And because I hurt all over, so I didn't know exactly where I was hurting at. It was just like all over. And then I found the tube like way up here, and I'm just like, what? And I was so confused. And then whenever they had to put in a second tube, they had to make a new hole and put in another tube. I asked them, could they do it lower? Because that was right up under my breast, and it was just very in a bad spot. They put it even higher. Very aggravating. Okay, so she goes on to say, "Have you asked to have a clamp?" Well, this particular one, I just thought of something. I could add a clamp if I was to take it out and pull the bumper off from the, deflate the balloon, take it out, pull the bumper off from the balloon end, because this end is all one piece. It doesn't come off. I checked that really good to see if I could get that Y port, if I could get that off to put a clamp on. But if that bumper would slide off, I could put a clamp on it, put the bumper back on, and then put it back in my stomach. So I might try that if I can find a clamp. Yeah, I might try that. I hadn't thought about that part of it yet. But anyway, she's saying she has a clamp and it helps so much. I mean, it's only logical to have a clamp. I just don't understand why I don't. I use a double layer of split sponges, and that helps too as far as keeping the area dry. I have been using double layer of those the 4x4 split sponges up until my insurance was helping with them. I used 2 because it comes 2 in the package. But now that I'm having to buy those myself full price, I'm using 1 at a time and not 2 because I'm, trying to make them last. So she says that, "I think these videos can be very helpful to someone who has just gotten a feeding tube because there's a lot of things we are not told that we just have to figure out for ourselves eventually." That is the truth. Like, they just don't load you up with information and tell you. They just like discharge you from the hospital. Good luck. Hope you figure it out. And it was the same way when we were in Cincinnati, Ohio at the Children's Hospital. Like, they just discharged us when my son got a tube, and I was just like, I don't know what to do. I mean, we just had to kind of figure it out. Back then, we didn't have Facebook. We had Yahoo Messenger groups. And so that's where I learned a lot of stuff back then. Let me see. I can't imagine your provider telling you no to putting a clamp on the tube for you. Seems like you should have one from the beginning. Keeping my fingers crossed that I will be able to have mine removed soon. Well, that is awesome. I'm happy for you, Kathleen, that you'll get yours removed. That is awesome. I hate that you even had to have one for a short while, or I don't know how long you've had it, but yeah, I would be ecstatic. Miss Curry, Miss Curry, I love her so much. She says, whoever invented this apparatus is amazing. That is the truth. And I was thinking that one day. I was just like, I bet the person who said, I mean, I can imagine these men sitting around, or doctors, you know, maybe women doctors too, but back in the day, I can imagine all these men doctors sitting around, and this one guy saying, what if we put a hole in their stomach and put a tube in it and pour their food in it? I could just imagine all these other men were just like, do what? But I'm thankful that somebody figured it out. Laurel says, thank you for sharing. Do you have to use a new bag for every feeding? That's a good question. I use a new bag every day, so I'll use one bag and that'll last all day. And then I use a new bag the next day. But now that I'm paying for those full price for myself, I may end up, trying to wash them out and use a bag for a couple of days. I'm going to try washing that out and see how well it washes out and stuff. She says, my apologies if you have mentioned that in previous videos. No problem. She said, prayers for your family. Thank you so much, Laurel. I appreciate your question. It's a very good question. Sylvia says, hi, Kayla. Have you lost any weight since you've had your feeding tube? Thinking of you and your parents. Yes, I lost 45 pounds as of last month. I'm probably a little bit more since then, but I can't tell it, like just looking at myself, I can't tell it, but if you go pull up last year's January video and today's video, you will see a big difference in my face and neck and everything. Clothes wise, I'm still wearing about the same clothes, but they're too big for me. My pants and panties want to just fall down, and I'm just trying to hold them and keep them up. Some days I will roll my pants and panties to cuff them a little bit to make them stay up. And sometimes I use a safety pin and pin my panties to my pants. I'm not one to just go out and buy new clothes just because. And if I continue to lose weight, then I'd have to buy them again. And I don't know, yeah, eventually I'll have to. And so the whole goal wasn't to lose weight, because I wasn't actively trying to lose weight anyway. But I have lost weight because I throw up a lot. Before I got the tube, I was losing weight then because I was throwing up, continuously, daily, all day long. And I still throw up a lot. So anyway, Maria says, I have so many questions. Well, good. Can you take a nap while feeding? Okay, I do not lay down while I'm feeding. Some people might take their feeds like during a nap or overnight. I do not, because the tube can come out of your port, the little Y port that comes up, and you put the tube into there. That tube can just come out of there so easily, and then the feeds go all over the bed. You feed the bed. I mean, when Elijah was a baby, you just do not know how often we fed the bed at night, or fed the floor, and he had carpet in his room. So, and the thing is, we got a new mattress last March while I was in the hospital, We got a memory foam mattress, and so I do not want to ruin that mattress with formula. So, I mean, I can just, that formula would just soak into that and it would be ruined. So, no, I do not do feeds while I'm asleep at all. Some people do, and you can't lay down flat because it will just come up your esophagus and you'll throw up. You have to be at an angle to do that. You have to sleep at a pretty high angle. Now on my bed, on my side of the bed, I do have one of those big huge wedges under my mattress on my side, and then I have I sleep on 2 pillows and a chihuahua, and so I'm raised up, but not as much as I'd really need to be if I did those bed feedings. But like I said, I do not want to get chance getting formula all over my mattress. And so, yes, I do sleep on 2 pillows and a chihuahua. One time my doctor asked me, how many pillows do I sleep on? I said 2 pillows and a chihuahua. Because Phoebe has to get up under my pillows. So, that's where she gets. So, do you get a feeling of fullness? I've answered that one, but thank you for the question. Did your son have the same type of feeding tube? He started off with a peg tube, like I have, the dangler. He had his for 6 weeks, and then he got a button after 6 weeks. Now, when he had his dangler, it was kind of long, and one night he was playing. He was in the living room with his daddy. They were playing, and all of a sudden, Jody starts screaming, "Kayla, Kayla," and I'm just like, I panicked and just like froze for a minute because I knew his voice meant something happened. And I froze just a minute, and I was able to run in there. Elijah was crawling on the couch, and his knee got on his tube, and his body kept moving, and it just popped it out of his stomach. So it's a long story to that, but we had to go to the ER, and they couldn't get it back in. They didn't have a tube to put in. I mean, it was like crazy. And so it was the next day. This doctor was trying to put it in. He was trying to stick a metal wire into the hole to open it up to put a tube because the hole closed very quickly. I was crying, begging him to stop. And Jody was like telling him, "Stop, stop. We will go somewhere else. Stop." Finally, they decided to take him to surgery and put it in the correct way. It was a long, drawn-out story. But anyway, they did put in another dangler, and then we were able to go from 6 weeks from the very first tube. We were able to go to New Orleans, Louisiana, and have a button put in, and that was so much nicer. Yes. Lastly, does anybody else in your family have some of the same health problems that you have? My sister passed away in January of 2020, and she and I had some similar health issues. Like I have lupus, and they were like in the process of diagnosing her for lupus. So, and she also had rheumatoid arthritis. So we had a lot of similarities. We were on a lot of the same medications. You're such a strong person, but more importantly, you have a beautiful disposition. Take care and praying for your parents. Thank you so much, Maria. I appreciate that. That's just, I mean, I don't see that in myself, but I appreciate your words so very much. Family Clan, thank you. Hi, Kayla. Thank you so much for sharing not only the positive, but also the negatives. If you don't mind me asking, I have a couple of questions. Do you get the full feeling after a meal? Can you drink at all with your scleroderma? I can drink. It's foods that won't go down. Now, sometimes, you know, I was in the hospital once before where water wouldn't even go down. So sometimes that happens. And after a day or so, it will relax, whatever it does. I mean, I don't know what it does inside, but I don't know, after a day or so, then I can drink again. Will you have to have the feeding tube forever? Well, my options were, my feeding tube is hard like a PVC pipe. It's no good. So my options are to remove that esophagus and put something else in there. And you know, you never know what's going to happen in the medical world. And she said, and Family Plans goes on to say, praying for your, keeping your parents and you in my thoughts. Take care and stay safe. Thank you so much, Jane. I appreciate that. I know you comment so much on my stuff, and I appreciate it very, very much. Brenda says, thank you for the information. Never have dealt with one. How long does it take to get the formula in you? Sorry, praying for the Lord to lay his hands on you. Hugs. Thank you so much, Brenda. Well, the rate of the formula is just how long it takes. Depends on the rate. That's what I'm trying to say. If I set the rate too high, then it goes in too fast and I throw up. But if I set it too low, it drags out all day, and I got to do that like 4 times. And so I try to find a happy medium. And so I just try different rates. I mean, I have, you know, different rates that I try, depending on if I'm wanting to leave the house soon, or if I'm wanting to go to bed soon, or whatever, you know, or needing to do something else. Night Owl, which is Vicky, says, Kayla, after each feeding, do you actually feel full? And does it take away your hunger cravings after each feeding? Well, I will feel full. I will actually feel kind of nauseated, like I'm going to throw up, but that formula disappears quickly, and I'm hungry. So I do feel hungry a lot. And sometimes it's, you know, sometimes I'm just like, I just want to eat. I just want to eat. I'm hungry. Oh, Denise says, I don't think it was graphic at all. It is a daily reality for so many people. Thank you for sharing with us. Thank you, Denise. I appreciate that. I appreciate your words and for your understanding. Deborah says, thank you for sharing. I worked with clients that had them. Thank you. Thank you so much, Sharon. Deborah, I appreciate that. Sharon says, hey, Kayla, did the doctor make you use a nasal NG tube for any length of time before placing your surgical tube? No, they did not. It was never even mentioned. Once they determined that my esophagus was hard and didn't work, it was determined, once they determined that, they just presented me with the information, and then we made the decision to either, you know, I had a choice, either a feeding tube or have my esophagus removed and my small intestine pulled up. And we chose to just go with the feeding tube, because supposedly that was going to be easier on me. So they never mentioned an NG tube, and my son never had an NG tube too, either. Sorry. He never had one either, so I've never dealt with an NG tube at all. The only time I've had anything like that was when I was sent over to Shreveport, Louisiana to have, I forgot what the name of the test is, motility maybe, I don't know. They did run something up my nose and down my esophagus, and it was like an ultrasound, and then they had me to drink the stuff, and they watched my esophagus to see what it did while I drank, and that's when they realized that my esophagus never even moved. It did not contract and try to help anything go down. And so while I had that, it was a horrible feeling. It really was. And then I started throwing up that stuff that I was drinking, and the thing about this test was you couldn't swallow. Like, you had to go I don't know how long. It seemed like forever. It seemed like it was for days. Like, you would drink this stuff, you could drink it in one gulp. You couldn't drink in more than one swallow. You had to drink one gulp, and then you couldn't swallow like your saliva. And the stuff I was drinking was like a salty Gatorade type thing. It was really nasty. And so they wanted you to drink, gulp it, down. Don't swallow until she tells you can swallow again. And so I'm just sitting there and my mouth is just watering like I'm about to drown. But I wasn't supposed to swallow it. And that tube also makes me just want to swallow, and it was, I don't think I could live with that. I mean, I know people do, and I'm assuming they just get used to it. I'm not sure, but that little one-day experience, I mean, that little test just lasted about an hour or so, but that experience was bad enough for me. Also, how many formulas did you try before you found one that worked for you? Well, I don't have any kind of intolerances, like I'm not allergic to protein or milk or anything like that. So basically I could drink any formula. It just needs to be, like high protein or whatever for me. So the first formula we tried is the formula that I'm on. And actually sometimes I have bought a different formula that might have been, I found a little cheaper or something. So just whatever I can find. I was shocked to find out that insurance doesn't cover your formula. Have you looked into patient assistant programs to help with the cost? I just did. Someone sent me a link to that. Thank you, Crystal. And I sent that information to my husband, and I'm not really sure if he has printed it out and looked at it yet. But I did send him that information to see if we might qualify for that. And she goes on to say, I used to work with a company that specialized in managing patient assistance programs for pharmaceutical companies. So perhaps they have those programs for feeding tube supplies and formulas too. It's a very great idea, and I appreciate you mentioning that. Crystal from Chronically Crocheting, she had just sent me that, I believe it was Friday or so. And so I did send that to my husband so he could print that and read it and look at it and everything, because after the week I'd had, I just didn't even have the mindset to even think about it. Terry says, my question is, can you make your own formula, like smoothies and soups? I do drink smoothies and I do eat soup, but I need this formula for the full overall nutrition and everything that's in it. Now, some people do make formula. I myself am not in any shape to go stand in the kitchen making formula or whatever it is you have to do. I don't even know how to make formula. But I'm in no kind of health-wise condition to do that and clean up and all that kind of stuff. So I will not be doing that. And the other people who live in my home, they have jobs and come home tired, and it's just not going to happen. Kathy says, thank you for sharing. Very informative. Well, thank you. Becky, my Dolly friend Becky, says, love, hugs, and prayers, Kayla. Thank you, Becky. Debbie says, that's a lot to have to deal with every day. It is, and sometimes it gets overwhelming. Like, sometimes it's just like, I just don't want to do this anymore today. Like, I'm done with the day. I just don't want to deal with this. I don't want to do it. But I have to do it, so. But it does get overwhelming at times. Anita says, are you getting more used to not being able to eat, or are you able to eat and keep some things down? I went over some of the, simple things that I can eat. I don't think I'd ever get used to not being able to eat. Eating is such a social thing also. When people want to celebrate, they want to go out to eat every holiday, or, everything revolves around going out to eat. Or if you want to get together with family, it's let's go out to eat, or, friends, let's go out to eat. So, sometimes it's hard. Christine says, thank you, so interesting. And Manic Mama Musings, Neva, says, thank you for sharing. And Neva has had COVID herself, and I believe she's on the upswing, but I've been praying for her. Vexy says, "Hi Kayla, my best friend, her husband is going through cancer treatments. Well, it's been a battle. His cancer is in his cheek in the first surgery, and the treatment did not do well. Cancer is still there, more surgery and treatment. He has had a feeding tube. Their biggest problem is the formulas. Are there any ways you found it, getting help with it?" I don't know what formula he is on. My formula that I take is made by Nestle, and so someone just sent me a link that Nestle might have some kind of patient assistance, and so that's what I was just talking about a little bit ago, that we are checking into that. So whatever formula that he is on, see if that company has the patient assistance program. I didn't know that that was a thing. I didn't know that, so I'm just finding that out myself. So that is something to look in at. Okay, I think that's all the comments. My screen's not scrolling anymore, so I hope that's all the comments and I didn't miss any. This has been a very long video, and if you have stayed to the end, bless your heart. Bless your heart. I thank you very, very much. I did want to share this video in this whole week with, friends or with anybody who wanted to watch, because feeding tube awareness is important, just to familiarize people and to make, there's so many different health issues out there. I have a few, and I know a lot of people on my YouTube channel has health challenges or health issues and just things going on in their life, and the more we make that different things like feeding tube, I don't want to say normal, but I guess normalize it. It's easier for people to understand or to explain to their kids and help them understand, because people can be cruel. I mean, even adults can be cruel. I've had people to say things and I'm just like, what? You have no idea what you're talking about. But, that's just life. That's probably about everything, Anyway, I appreciate y'all watching. If you watched all 5 days, give yourself a hand. Thank you. I know that my day 5 here is late, but I, had some things going on and just had to take care of myself. And that's what I did. But thank you so very much, and I appreciate you all, and I'll see you in the next video. Bye, friends.